My name is Susan Stevenson, and I'm the Director of the FREEDOM Wellbeing and New Zealand Curriculum Design Institutes. They're both research institutes, and today I have the pleasure of welcoming you to this official launch of the Universal Wellbeing Charter, a framework for global and primordial prevention. Today at this launch, I'm going to give people a little bit of background on how this document came to be and what has happened since it came to be, and what are its future plans. So I just welcome everybody here today. I know we have several people from different countries, so thank you for being able to get here. I know time zones are very difficult, and some of our students are actually asleep at this time, so they're here in spirit. I'd just like to begin the launch today with the inspirational statement we started with at the first Prevention Imperative Universal Wellbeing Conference in 2025. And we took the statement from one flame, infinite radiance, together we spark global universal wellbeing. And we were captivated by this idea that just by sharing ideas about universal wellbeing over time, that it would develop and we would start to spread these ideas. So we didn't begin with a vision to do this. It has been gradually growing over really a process since 2008 when we began working on universal wellbeing. To help many people who are coming to terms with this new idea of universal wellbeing, we've introduced this lay definition, and I have to thank someone who's here today for the development of this definition. So we've decided that universal wellbeing is actually the science of realizing human potential. And we do have a more technical research-based definition of universal wellbeing, and that is designed to assist people who are testing the model and hypotheses relating to it in relation to universal wellbeing. And of course, over time, research could change that definition. One of the things we began grappling with back in 2008 was this idea of understanding well-being. And although we were aware there were many different views out there, what we began to do is to actually really begin from ground zero, working in a higher education community. And as we commenced on our journey, this question about what well-being is, we found to be highly contested. So as a result of our research, we came across over 1,000 definitions of well-being. We also came across over 500 models or explanations of what well-being is. And then the final point in that journey was that we came to understand that less than 5% of what we found had any kind of evidence base supporting it at all. So just to help locate the charter, we just introduced these ideas that there's currently 3 major paradigms or research directions in wellbeing. One of them is based in psychology, medicine, and the health sciences. And this particular paradigm sits within the health system, and its major focus is on diagnosing and treating individuals experiencing severe poor wellbeing conditions such as depression and psychosis. And a popular model in this paradigm is, for example, the PERMA model. The second paradigm that we discovered was a paradigm that was focused on supporting human potential, thriving and flourishing, and a sense of freedom. And this particular paradigm is based in multidisciplinary and transdisciplinary evidence, and it has an authentically holistic focus. So it works really hard to see the whole person and support the whole person. And the universal wellbeing model on which this charter is based is an example of that. There's one other paradigm we actually started working in, which was a special populations paradigm. And this is where we began working, in our case, with an Indigenous model. And we started using it as the basis for intervention programs within a higher education context, with a view to supporting equity and increasing the numbers of people actually achieving programs, something that is globally problematic. So the universal wellbeing model sits firmly within the second paradigm, but it has a reciprocal relationship with the first paradigm, as in the universal wellbeing model is hopefully helping people to not move into that area of serious need where they need clinical supports and the psychological medical health model, but it also often works with